Alberta Primetime with Michael Higgins.
Welcome to Alberta Primetime. Ahead tonight, our politics panel on the impact of Stephen Guilbeault's resignation from the federal cabinet. But first, the protection of personal health care information.
There's not even a picture attached to your healthcare card number, and so that can easily be given around to different people and you go in and use that number, whereas a picture on a driver's license along with all of the other protections that are in place would make sense.
One of Alberta's health ministers addressing the government's plan to add healthcare numbers to driver's licenses and other forms of identification, a move that has prompted Alberta's Information and Privacy Commissioner to raise a number of concerns. And Diane McLeod joins us now. Commissioner McLeod, good to see you.
Good to see you too, Michael. Thank you for having me on the show today.
All right. Now, the addition of healthcare numbers to driver's licenses, that was announced back in November. You've since written to the government expressing concerns. So what's worrisome from your standpoint? What does your letter highlight?
Well, my letter highlights, so it's in response to Bill 11, which is the Health Statutes Amendment proposals. And within that, of course, is the proposal to add personal health numbers to driver's license. And this is in addition to adding the citizenship marker as well. So what I wanted to highlight, first of all, is that having personal health numbers on your driver's license certainly creates the risk of proliferation of personal health numbers when you're using your driver's license to show at many different places. So for example, if you go to a bar, to a liquor store, if you rent a car, if you go to a hotel, there's many places that you're showing your driver's license that would then expose the personal health number on the card. So that is one aspect of the concern that I raised. And it's important for people to understand that these provisions in health legislation exist to prevent personal health numbers from being used as forms of identification. So these laws came into effect in the early 2000s to ensure that personal health numbers would only be used by healthcare providers to avoid that risk of fraud. So now we've come full circle, and now we have personal health numbers on identification cards, which means that that risk of exposure expands significantly, and it creates significant risks to Albertans for a number of reasons. One of them is that, as I just said, when you're showing your health information in different places, you're revealing your personal health number, which is copied in many occasions. So even with the controls that they've put in place in the amendments to the Health Information Act, which are a person who collects this information cannot use or disclose it for any purpose, that only applies to people in Alberta. So let's say, for example, I'm in British Columbia, I'm renting a car, and they copy my driver's license with my personal health number on it. Now, that law no longer applies to those in British Columbia. However, they still have my personal health number. So this is a concern, and the controls don't go far enough to protect the information. And in my view, the personal health number has no business being on a driver's license.
Okay, so given those risks, how much of a window could that give someone into the lives of Albertans?
Well, I think the key risk, so there's two pieces to it. One is actually the billing system. So we have a publicly funded healthcare system, and if people are using health numbers to obtain services, whether it be in Alberta and other parts of Canada, that is an impact on our healthcare billing system, which again is one of the reasons why we had these prohibitions in the legislation in the first place. The other thing that Albertans need to be concerned about is if somebody actually uses your personal health number to obtain care. And we know today that we have much greater integration in our health records. So as a result of that, if somebody were using your personal health number and obtain care, that information could then end up on your health record. And that could have some serious consequences. For example, if there's different blood types, different allergies. So these are risks that could be prevented by not having this information that's available widely in a number of different scenarios.
Okay, so to what degree was your office consulted on any of the changes prior to the government signaling this go-ahead?
We have been made aware of the modernization of the healthcare card. We didn't know exactly what it would look like. We haven't met with government on this yet, so a while back, it came out with the Canadian citizen markers, which was the first thing that triggered sort of a public response to those that addition of the information and those concerns. So as a result of that, I contacted government. They informed me, and they were correct, that the Registrar of Motor Vehicles is not subject to privacy laws in Alberta and does not have to provide a privacy impact assessment to my office so that we can assess the privacy risks associated with this activity. However, they have agreed to meet with me, so we're hoping that we can discuss the risks associated with this, which is also much broader than what I've even said. But given the time we have on the show today, I'll leave it with sort of the high level risks that I just relayed.
Okay, so is there a degree of protection that is feasible to be applied here that the government could use to continue taking this forward? What would still need to happen?
Well, that's a good question. I think if we had an opportunity to speak with government, we might find ways that we could somehow mask the personal health number on the cards. I'm not sure. I would have to talk to my technical people in my organization to look for opportunities. Another important thing to know is that government is actually offering another alternative to having personal health numbers on your driver's license, and that is through a digital wallet. So they are trying to advance that objective first. So if Albertans choose that option, they would be better protected, because if they don't have that, chances are they're going to have to put it on their driver's license. The issue that I have with that, excuse me, is for seniors. Many seniors have a hard time operating technology, and I think there's many seniors that would be concerned about having their personal health number on their driver's license. I really do think it would be wise for a reconsideration to have a separate card that people could apply for through Alberta Health.
Okay, maybe one more quick question for you. Given all of this and the reality of now being in this age of AI, how concerned should Albertans be about privacy, about protection of their information?
Are you talking about AI in general, or as it relates to the identification cards or the risk of cyber attack? Because I would say that because we have artificial intelligence combined with quantum computing, I think the risks of cyber attacks are significant, meaning that if you have organizations that have collected your health information, the risk that it would be accessed by a malicious actor only increase because of the use of artificial intelligence.
All right. We'll leave it there. Appreciate your time this evening, Commissioner MacLeod. Thank you kindly for this.
Thank you.
Diane MacLeod is Alberta's Information and Privacy Commissioner.